is still unclear. And it is well known that after the meal, the dietary glucose past the pancreas will trigger the insulin secretion, and insulin will promote the lipogenesis in the liver and also inhibit the hepatic glucose production. Meanwhile, insulin also promotes the glucose uptake in the skeletal muscle and also adipose tissue. So indeed, hepatic insulin deficiency also leads to diet-induced NAFLD. This can be said is with the inactivation of insulin receptor, inactivation of insulin receptor can reduce the lipid accumulation in the OBOB mouse model. And consistently, Chardon's work did 2009 found deletion of either ICE1 or ICE1S2 both also can prevent high-fat diet-induced fat liver. And AKT is the same when deleted AKT2 also prevent high-fat diet-induced liver. And those mice also develop type 2 diabetes and this suggests that hepatic insulin deficiency can cause insulin resistance in both lipid and glucose pathway. So based on this, because in humans with typical insulin resistance, the liver shows higher levels of hepatic glucose production, but also higher levels of lipogenesis, then produce the deadly combination of hyperglycemia and also NAFLD. So Dr. Brown and Goldenstein has proposed a selective insulin resistance model. And in this model shows insulin cannot inhibit glucose production, but can continuous active lipogenesis. So this paradox has been widely studied, and many attempts has been made to explain this paradox. One man's thought is about maybe insulin signaling is intact in the liver during insulin resistance in humans. And in this case, insulin can activate the lipogenesis, but insulin cannot inhibit hepatic glucose production, mainly through the unsuppressed lipolysis in the adipose tissue. Because lipolysis can supply the gluconeogenesis with a substrate as glycerol, can also activate the PC activity through increased acetyl-CoA in the liver. But this is contrasted to another experiment. This performed in dogs. They found when perfuse insulin directly into the portal vein, then pass over the liver, can dramatically inhibit the hepatic glucose production. However, when perfuse insulin into the artery, so the insulin will go first to the peripheral vein and failed to suppress the hepatic glucose production. This means the insulin direct effect on the liver also may be dominant the control of the hepatic glucose production. Another major thought is, well, in human, if the insulin signaling is defect, so as reasonable is insulin cannot suppress hepatic glucose production, but the lipids in the liver can come from the adipose tissue lipolysis, all come from the diet. Because in human study has shown that the lipids in the fatty liver is mostly come from the lipolysis, and only 26% from the de novo lipogenesis. However, another experiment shows hepatic de novo lipogenesis continuously to contribute to the lipid accumulation in the liver in obese and NAFLD group. So although this model selective insulin resistance has been proposed, decades of intensively investigation still cannot get a consistent conclusion on this paradox. Our lab tried to explain this phenotype from a different angle. So the first part we tried to talk about from the nutrition angle. So we found that the total insulin resistance can promote fructose-induced NAFLD. And the second part we want to talk about from the special regulation of the glucose and the lipid metabolism by insulin signaling. Maybe has some implications for the NAFLD treatment. Firstly, the mouse model we used is control mice with wild type and flux mice, and LDKL mice with inactivation of the ICE1 and ICE2 in the liver, and also LTKL mice with inactivation of ICE1, ICE2, and FOX1. So it's 15 years ago. Postdoc in Morris White lab identified that the LDKL mice can develop hepatic adenoma when maintained on chow diet. And however, this project has been ended because only 30% of the mice can develop adenoma. And also each cohort has a huge variation, and it's hard to get a consistent result. So, and instead, we might be able to challenge the LDKL mice with some diet. So we choose the GAN diet. Why we choose GAN diet? Because GAN diet can induce the NAFLD and the NASH, which is very close to the human phenotype. In either the histology or the gene expression pattern is similar. And this diet also can mimic the processed food of the humans. Then we treat our LDKL mice on the GAN diet, and we have to stop the experiment in 10 weeks because half of the LDKL mice died during the experiment. And then we go back to check the mice after on the GAN diet for only 8 weeks. We found this mice has a serious hypoglycemia and also glucose intolerance. And also the serum after spin down looks full of white. And surprisingly to us is we found the total insulin resistance even can promote the GAN diet-induced fat level. This can be shown by the HE staining and also oil red staining and also lipid accumulation concentrations in the liver. And also total insulin resistance in the liver can promote the inflammation and also fibrosis. So this finding is totally controversial to previous finding is hepatic insulin signaling deficiency can prevent diet-induced fat liver. And that is the basis for the hypothesis of selective insulin resistance. And so what's the mechanism behind this phenotype? So firstly, we know that the GAN diet contains 40% high fat and also 20% fructose and cholesterol. So to confirm the previous data, so we treat the LDKL mice with 45% high fat diet. Then consistent with Chandon's data, we found the LDKL mice can resistant to diet-induced fat liver and also associated with reduced lipogenesis. Excuse me. Then we treat the mice with 20% with 60% fructose. Well, because the GAN diet has 20% fructose and also 10% sucrose. And interestingly, we found is when the LDL on the fructose diet, it has can develop the fatty liver disease. You see, compared with control, the LDL liver has full of fat. And after 20 weeks treatment, the liver even shows a white spot, indicates some indicates some the earlier stage of the cancer. So as we know, the sucrose and also high fructose corns are the two major added sweeteners used throughout the world. And it's included in 30% of processed food available in the grocery store. And even some fruit, we thought it's a healthy fruit, still contains high amount of fructose. So only in the last couple of years, and some pioneer work has been done by the Wills lab. They found contrast to previous thought is the liver is the main site of the fructose metabolism. They found that intestine firstly clear the most of the dietary fructose, and high fructose can spill over to the liver and also to the microbiota. When the fructose spill to the liver, the KHK is the first enzyme can digest the fructose to form acetyl-CoA and also to form the lipogenesis pathway. One of the collaborators feed the mice with a higher amount of fructose. Then they block the KHK in the liver. They found, well, the KHK in the liver is very important. And blocking the KHK can completely protect the high fructose induced the fatty liver disease. So in this case, we thought about maybe the LDL mice gains more fat on the fructose diet, mostly through the KHK in the liver. Then we generate the LDL KHK knockout mice with the inactivation of ICE1, ICE2, and also KHK. But surprisingly, we found that without the KHK in the LDL mice when put on the GAN diet, those mice still develop serious glucose intolerance. And the serum still full of lipids, and also the triglyceride is increased to like 700. Some of the mice is even higher. So this consistent with the liver. So deletion of KHK cannot rescue the NAFLD and the NASH phenotype in the LDL mice on the GAN diet. So the lipids still accumulate more in LDL mice when deleted the KHK. So in this case, the KHK in the liver doesn't responsible for the NAFLD development in the LDL mice. So what's the major reason? So then we isolate the lipids from the LDL liver and control liver and perform the mass spec, sugar mass spec. We identified most of the lipids is unsaturated lipids, and only minus amount are saturated. So it is well known that the saturated lipids in the liver is most from the de novo lipogenesis, and the unsaturated lipids is most from the free fatty acid uptake from the circulation. And to confirm this hypothesis, we measure the de novo lipogenesis in the LDL and control mice on the fructose diet. we found that the level of lipogenesis decreased 64%. And then we performed the IS sequence of on the liver of mice on either high-fat diet, fructose diet, or GAN diet. And consistently, the genes involved in the de novo lipogenesis were dramatically reduced. But bring our attention is the lipid uptake and esterification is increased in LDKO level when maintained on the either fructose or GAN diet. So we have a paper published to try to identify how the liver communicates with the fat during the total insulin resistance. Then we used the AAV TBG, encoding each of the hepatocytes that is dysregulated in the LDKO liver and then normalized by the FOX1. Then we identify the follistatin is an important factor secreted from the liver and triggers the adipose tissue lipolysis, then supply glycerol for the hepatic glucose production. So now we think the LDKO mice on the fructose diet, most of the lipid is probably from the adipose tissue lipolysis. So to test whether FOX1 FSD pathway is indeed regulates the free fatty acids supply to the liver, we firstly we inactivation of the FOX1 in the LDKO mice. So from this data, we can see when we inactivation of FOX1, the liver size is reduced, the serum is clear, and the lipid accumulation in the liver is tremendously reduced, even far beyond the control. And the lipids accumulation and also fibrosis are all normal in those mice. How about the FST? We also generate the LTKO FST mice with inactivation of the ICE1, ICE2, and the FST. So similar to FOX1, when FST was deleted, the liver size is small and the serum is clear, and also reduce the lipid concentration in the liver. And also reduce can be reflected by the HE staining. Also, the fibrosis is improved. So whether the FST really can driven the progression of NAFLD to NASH, we check in the wild type mice maintained on the GAN diet. So when we treat the wild type mice with GAN diet for 7 months, ideally some of the mice will develop NASH, develop some mild fibrosis. Then we inject the mice with AAV TBG encoding either GFP control and the FST long forms in the liver. Only in 2 months, surprisingly, we found the liver expanded 55 percentile, and some of the liver has developed serious cancer. And the fibrosis staining and also HE staining, we can see can be confirmed also by the Serrat staining, shows FST can dramatically increase the lipid accumulation, also the fibrosis, and even can cause the hepatic carcinoma in these mice, in wild type mice. And now we know the lipids is mostly from the adipose tissue lipolysis, but why the DKO can resistant to high fat diet to induce the fat liver, but promote fructose enriched diet and induce the fat liver. So then we go back to this is a triglyceride backbone. So triglyceride composed of the glycerol backbone and the fatty acid. And the fatty acid can be from the adipose tissue lipolysis. So we thought about, well, maybe the intestinal fructose metabolites can contribute to the glycerol backbone of the TAG synthesis. So because why we have this hypothesis, because during the hepatic insulin deficiency, the glucose cannot be metabolized in the liver because of the inhibition of the GCK expression. So to test this hypothesis, we tracing the fructose metabolism in the LDKO and control mice on the fructose diet. Then we measure the circulation metabolites, labeled metabolites. We found many of the metabolites are increased, including the glycerate, also G3P, which can contribute to the glycerol 3-phosphatase and also DHAP in the liver. And indeed, we found that the level of glycerol 3-phosphatase and also DHAP are increased in the LDKO liver. And whether those contribute to the glycerol backbone of the lipids in the liver, and we collaborate with Dr. Huishen's lab, and we hydrolyzed the TAG in the liver, then measure the glycerol backbone of the level of the glycerol backbone of the mice. So we found, indeed, we found that glycerol level of the glycerol backbone dramatically increased in the LDKO lipids compared with the control lipids. Elevated circulation follistatin also associated with risk of the type 2 diabetes. And one of our collaborators also found that the serum FST level is strongly associated with the adipose tissue insulin sensitivity, and also increased in the circulation of humans with NAFLD. This somehow indicate inactivation of follistatin might be able to reduce the lipid accumulation in humans with NAFLD. Well, mostly I would like to say that these people has a higher amount of fructose uptake regularly. Okay, I want to summarize this part. This part talk about the total insulin resistance can prevent high-fat diet-induced NAFLD, but can promote fructose-enriched diet-induced NAFLD. And the mechanism behind it is a FOX1 follistatin pathway activated during the total insulin resistance. This can promote the NAFLD and NASH progression in mice on a fructose diet. And the paradox of selective insulin resistance is not applicable under high fructose diet condition. Okay, and next part I want to talk about the mice on high fat diet condition. So high fat diet indeed can induce fatty liver and also can cause glucose intolerance. And insulin also failed to suppress the hepatic glucose production in mice on high fat diet. This suggests that the glucose pathway is insulin resistant in mice on high fat diet in the liver. So my hypothesis is whether we targeting periportal hepatocyte can be used for the treatment of hyperglycemia and also NAFLD. So as we know, the single cell sequence recently has identified the gene expression is expressed in a xylation pattern. So the blood enriched with oxygen, insulin, also nutrients from the portal vein to the central vein. So the gluconeogenesis genes are enriched in the periportal hepatocyte, and the lipogenesis are enriched in pericentral hepatocyte. So if this is true in mice, even in diabetic condition, so the type 2 diabetes with NAFLD has an increased gluconeogenesis and lipogenesis, should be insulin-resistant portal hepatocyte, but insulin-sensitive central hepatocyte. And if you look at the section of the liver in mice on hepatitis diet, we used the GS to label the central hepatocyte. So the central vein, hepatocyte around the central vein are full of lipids, but the hepatocyte around the portal vein has very little lipids. So we are wondering, we want to test this model. So if only portal has resistance, and in this case, insulin cannot suppress the hepatic glucose production, then will cause a hyperglycemia and indirect induce a hyperinsulinemia, which both factors could contribute to the enhance the de novo lipogenesis in the central hepatocyte. That's caused a combination of hyperglycemia and NAFLD. So to test this hypothesis, we first need to generate the portal insulin resistance mouse model. So with a collaboration with Dr. Howard's lab, we introduced a GLS2 CRE-ER, this mouse model. By contrast to the GS expression in the pericentral hepatocyte, we found that the GS is mostly expressed in the periportal hepatocyte. And this CRE has some leaking in the pancreas, but not in the islets. So we believe it cannot affect the metabolism of this. And then we deleted IS1 and IS2. We call it GLS2 DKO mice. So the knockout efficiency is good. We can see this IS scope data compared with the control mice, the periportal IS1 and also IS2 were dramatically reduced. And the approach we used to separate the periportal and the pericentral hepatocyte with two methods. One is very simply we use a micro dissection. We cut the liver sections and use the punch to collect the red with and the non-red cells. Another way is we use the FACS. So isolate the hepatocyte, then use the cherry as a channel to get the red and the non-red cells. Then we culture that. So firstly, we want to know whether periportal hepatocyte insulin resistance can cause glucose intolerance and hyperinsulinemia. And indeed, when inactivation of the IS1, IS2 in the portal hepatocyte, and we expected that insulin cannot suppress the hepatic glucose production and cause a glucose intolerance and also cause a hyperinsulinemia. Next, we ask whether this combination of the glucose intolerance and the hyperinsulinemia can induce the fatty liver in those mice. So we firstly measure the de novo lipogenesis. As unexpectedly, we didn't see the lipogenesis increased. By contrast, it's even decreased 50%. And then we go back to check whether the deletion of the whether portal insulin resistance can increase the genes, the fatty acid, the lipogenic protein expression in the central hepatocyte. And in the control mice, FASN is the major enzyme for the lipid synthesis, and the PEP-CK is a major enzyme for the gluconeogenesis. So gluconeogenesis, PEP-CK, is always expressed in the portal hepatocyte. And when deleted IS1 and IS2, the portal hepatocyte lost the FASN expression, but doesn't increase in the central hepatocyte. And well, finally, we also measured the lipid concentration. We also didn't see any increase in this mouse model. So how about on how about the beta oxidation? So we isolate the hepatocyte and we separate the hepatocyte. We found when delete IS1, IS2 cause a hepatic insulin deficiency in the portal hepatocyte, it dramatically increase the beta oxidation, but decrease the lipogenesis in the portal hepatocyte, also in the central hepatocyte. And how about on hepatitis diet? So we treat them, we put the mice on hepatitis diet for 2 months, then gave it to tamoxifen to induce the Curie expression another month, then end the experiment. So we found, well, and it's totally update to our expected. So the deletion of the portal insulin signaling S1, S2 can reduce the lipid accumulation in central. And we used the co-staining of oil red and the TT tomato in those mice. So here we can see on the control mice, most of the lipid is enriched in the central hepatocyte, but it's reduced in the portal knockout. So this data suggests single portal insulin resistance, although it can induce hypoglycemia and hyperinsulinemia, but it's not sufficient to drive in the NAFLD. So how about in the central hepatocyte? So since we found the portal insulin deficiency can increase the oxidation and reduce the lipogenesis. So if we only reduce the IS1, IS2 in the portal hepatocyte, it could be reduce the lipogenesis, but increase the lipid oxidation and might be able to reduce the fat accumulation in the mice on the high-fat diet mice. So then we introduce another mouse model is CYP1A2 Curie. So you can see the CYP1A2 Curie is overlap with the central hepatocyte marker GS and has no leaking in other tissues. And firstly, we compare the glucose metabolism by the central and portal. So, and you see, central insulin resistance can protect, can even improve glucose tolerance, but portal insulin resistance can impair the glucose tolerance. Although both mouse models can induce the hyperinsulinemia, but we use the hyperinsulinemia euglycemic clamp. We found that the only portal knockout mice shows a systematic insulin resistance as indicated by the glucose infusion rate. And insulin suppression, hepatic glucose production also only impaired in the portal knockout mice, not in the central knockout mice. And we're also tracing the glucose because glucose metabolism is tightly regulated by insulin in the liver. So we tracing the glucose metabolism during the fasting condition. So after fasting, we give a low dosage of glucose, and then we can keep the glucose at a steady state. So the heat map shows the compounds involved in TCA cycle and the glucose metabolism is totally opposite. It's increased in the portal knockout, but decreased in the central knockout. And the pathway analysis, we can see that is, well, compound involved in the gluconeogenesis will increase, also beta oxidation is increased. But it's pathway involved in the gluconeogenesis in the central knockout is kind of a mild decrease. So how about during feeding condition? And we also measure the glucose metabolism during the feeding condition in the central knockout. Here we can see during feeding condition, the beta oxidation is increased, but the glycolysis pathway is reduced. So this means glucose cannot get into the liver in the central knockout mice, but also increase the beta oxidation. Then we measured the de novo lipogenesis and also the beta oxidation. And indeed, this data is consistent with the glucose tracing. We found that de novo lipogenesis is dramatically reduced and the beta oxidation is dramatically increased. How about on the hepatic diet, whether these mice can prevent diet-induced fatty liver? Then we treat the mice similar, same protocol as before we put the mice on the portal knockout mice. So you see, we delete IS1, IS2 in the central hepatocyte, and as expected, the central cells has increased the beta oxidation, but decreased the lipogenesis. And we co-extending the oil red and the TD. We found in those mouse model, the TD labels the central hepatocyte, most lipids is increased in the central hepatocyte, but it's dramatically reduced when we delete IS1, IS2 in the central. So this suggests insulin signaling maybe is not benefit for the NAFLD in the central hepatocyte. So we also found other interesting thing is central hepatocyte also is important for the insulin clearance. Because we have data shows that is, although both mouse model induce hyperinsulinemia, but when we compare the C-peptide ratio to the insulin, we found that the C-peptide is the ratio is dramatically reduced in the central knockout mice. This means the central is the major site for the insulin clearance. So reducing insulin clearance may be helpful because it can shift the insulin's anabolic function from the liver to the muscle or the adipose tissue, like increase the glycogen synthesis in the adipose tissue, in the muscle, and also increase the lipogenesis in the adipose tissue and protect the liver from hepatic steatosis. Also far beyond this, we also noticed the central knockout can also has an increased systematic energy expenditure. So thus we assumed maybe deletion, inactivation of insulin signaling in the central hepatocyte may be benefit for not only the fatty liver disease, but also for the obesity and other things. Okay, I give a summary for this part. What's important is periportal insulin resistance is not sufficient to induce hypoglycemia and the NAFLD, especially for the NAFLD. And targeting pericentral hepatocyte insulin signaling might be a good strategy to reduce the progression of NAFLD. Okay, I'm ending here, and I want to thank all my collaborators, and especially Dr. Hao Zhu's lab and also Hui Chen's lab for the mass spec and the mouse model. Thanks so much, and I want to take any questions.
Thank you very much, for the wonderful presentation. Now it's open for questions. I already saw one question from Haibin, I think. Is Haibin still around? We can discuss about that question. Ruya, can you look at how
to... Okay, I can look. Okay, how to explain increase glucose output when insulin was given peripheral in the paper you referred to. I didn't thought about that, but I have no idea. Yeah, sorry.
That's okay.
I have a question, Charlie. Habib, you want to continue?
Yeah.
Habib, you're done?
Habib, do you want to comment on that? Or you can discuss later. I don't think he has any data to talk about that. Maybe.
No, I'm just curious. Maybe if I may, I can ask another question. So your first part about the follistatin. So if I understand it correctly, it's a secreted protein. So do you have any ideas how this follistatin can regulate, fructose metabolism in the liver?
No, we haven't found the follistatin regulate fructose metabolism. But follistatin is kind of a funny thing because it's a downstream of insulin signaling and has a very conserved function as insulin signaling. We found that in the liver, it can inhibit the lipogenic gene expression. But when put on high fructose diet, it can promote the fatty liver. But when put on a high-fat diet, it can prevent the high-fat diet-induced fatty liver. All expression of follistatin in the liver has totally opposite function when maintained a high-fat diet and high fructose diet.
I see.
FST288 is autocrine forms. Another one is 315 is the endocrine forms can circulate into the circulation. Yeah.
I see. I have a question. By the way, great talk. Very nice model, complicated genetic manipulation. So we also did some double knockout, triple knockout mice in different contexts. A couple of weeks ago, I got a question from Schwabi said, the question I want to ask you, it's very nice you deleted this, IS1, IS2, or even more protein in the central and the portal hepatocyte. Apparently affect the glucose, insulin. My question is, in the physiological conditions, like a human disease, do we know anything where we see human have this, specific triple G mutation?
No, I didn't see that. Human data is hard to understand because it's not tissue specific. It's also not you cannot treat insulin to see what happens, and even insulin resistance. This concept is also questionable. I mean, mostly de novo lipogenesis method is feeding driven. We believe this is a feeding can driven insulin secretion, then cause the lipid accumulation. Then whether it's isolated only insulin function, I didn't see like the type 1 diabetes compared with type 2 diabetes, one with insulin, one without insulin, give feeding. What's the difference between? So I didn't see any paper shows that. So for the human level, we just guess. Yeah.
Okay.
Thank you.
Thank you.
Thank you, Wei-Xin. Roya, the next question is from Hypo, asking about your DKO data.
Okay. The FST expression levels is similar between mice, LDKO mice on either high-fat diet or fructose diet. So always high. There's around 20-fold increase in LDKO mice. Yeah.
I see. Okay, great. Next question from that Wenping Zhou regarding.
I can ask in person if so very nice talk, by the way. I actually, because I had another meeting, missed the first part of your talk. But when I looking at listen to your other part, because in our previous study we show this insulin signaling is crosstalk with bile acid signaling. So did you see any difference in the bile acid signaling in your model?
I didn't, because another lab in our floor, Suda Bidiga, is working on the bile acid signaling, but we don't want to crosstalk with their area, so we didn't look at that. Yeah.
Okay, thank you. But I think this is a very important area, of course, because I'm working on the bile acid. I always encourage people to looking at. We have seen the crosstalk with insulin signaling with bile acid in the hepatocytes. Yeah.
Okay, you may try this cream, maybe works. Yeah, in different
Okay,
resolution. Yeah, yeah. Thank you.
Okay, I think it's my turn. So, hey, yeah, it's great to talk. So I always kind of insulin resistance is so complicated to me. So my understanding correctly, in your gun diet, LDKO mice, they have more fatty liver, and also from your picture, it looks like the body weight is decreased, right?
Yes, because both LDKO mice on either high fat or GAN diet, they cannot gain weight as a control. It has enhanced lipolysis.
Okay, so lipolysis is from the deposit tissue.
Yes.
Kind of some triglyceride going to the liver. That's makes it worse. So my question is, do you think if you deal with like PPAR gamma agonist like ROSI will improve this phenotype?
Oh, this is a good point. And I believe it will, because it will keep the lipids in the adipose tissue.
Yeah.
And could be, yeah.
So next question is, do you see any kind of mutation in the RS1, RS2? So that could be, those kind of drug could be suitable for those patients in a human.
I saw we collaborated with the endocrinology clinical in the Boston Children's Hospital. So they found some kids with IS1 mutation. And these kids, most problem is not metabolism problem, it's mostly growth problem. Cannot grow well. It's small, short, yeah. And in mice, when delete IS1, it's kind of fine, because the only thing is whole body IS1 deletion is small, those mice, yeah. But if you check the metabolism, is almost okay. I think the IS2 is a redundancy function there, yeah.
Yeah, great talk. Thank you.
Thank you.
Thank you, Dwayne. Next question from Dr. Shen Wu. Are you still around? Oh, hi, Shen.
Hey, Charlie, and thank you. Wonderful talk, Rongya. I think we are studied very similar, but I'm probably in the baby process. So I have some naive questions. So when you give the high-fat diet to the mice, and when you knock out, you see the liver have a protection, right, by the insulin resistance. So then I assuming the triglyceride in the circulation also increased. Did you see?
It means which mouse model? It's
so in your knockout, double knockout, RS1 and RS2 knockout mice, when you fed the high-fat diet, so they are protect NAFLD, right? Or MAFLD.
Yes.
Then that which is that is the following question: do you see increase the circulation of triglyceride?
Yes, the triglyceride. When the LDKO mice on high-fat diet, the triglyceride in the circulation is reduced. But when put on high fructose diet, it's dramatically increased.
Okay, so anything I see you study a lot about the novel lipogenesis and oxidation. Did you look at the secretion or uptake pathway? You know, anything?
Yes, we worked on that, and I didn't get solid data for that part. I tried to use the fluorescence level fatty acid to trace. That one is usually for the in vitro assay, right? So I tried to do it in vivo. So I'm not sure that data is correct or not. So I have to confirm with the C14 labeled palmitic acid uptake. Yeah. So that is why I gave the data here. Yeah.
Yeah, we are doing the same thing. The data also not solid. We're confused. And another question followed is when we give our mice, our female, I assuming you are working with male, right?
Yes.
So when we give our female mice high dihydrotestosterone is androgen, male hormone, with high fat, high glucose, high cholesterol, the Western diet we call. Because I know the DHT is in liver total insulin resistance. Surprisingly, we got the same phenotype as liver was protected. They are not produce MAFLD. However, they increase the triglyceride circulation. So we are thinking it's probably different pathway as you talk about the novo lipogenesis or oxidation. It probably through the uptake and secretion. So that's I'm wondering if, since you are expert, any comments? We are struggle to find the mechanism. Yeah, thank you.
My feeling is, in my opinion, de novo lipogenesis is always associated with the serum triglyceride levels. But in our mouse model, I still cannot explain. So, but it somehow can also associate with lipogenesis. It's not de novo lipogenesis, not only de novo lipogenesis. So our LDKO mice on high-fat diet has reduced de novo lipogenesis, the serum triglyceride reduced. But when put on fructose diet, the de novo lipogenesis reduced, but the overall lipogenesis increased. So the serum triglyceride is also increased. I think the serum, I know some people use the serum triglyceride sensitivity as a marker of the de novo lipogenesis. It's not quite true, I think. The serum triglyceride can only reflect the whole liver lipogenesis.
So it means it's major on the lipogenesis. It's not a kind of a secretion, anything like you think they may secrete more, or they do not uptake enough, free fatty acid.
I don't know the VLDL pathway is important or not, because in human, the VLDL expression and it's totally different from the mouse, and always has some controversial study compared with humans. So my opinion is that the lipogenesis, probably the total lipogenesis triglyceride levels related to the circulation triglyceride levels. Yeah.
Okay, thank you. I may contact you later. So thank you so much for your beautiful talk.
Thank you.
Thank you. Thank you very much. Any other questions? I think we are on the hour right now. No more questions, so we can thank Dr. Tao again for the great talk. Okay, thank you, Ria. It's a wonderful talk. Nice to see you as well. Okay, bye.
Bye.